There are many potential medications available to treat asthma. Each patient's asthma treatment plan is individualized based on their symptoms and their history. A personalized asthma action plan is an individual management plan created for a patient by their doctor that outlines particular symptoms that they can monitor for and the appropriate treatments recommended for those symptoms. By developing an asthma action plan with your doctor, patients are able to identify warning signs for worsening of asthma symptoms and the appropriate treatment medications that patients can use in order to improve asthma control. The action plan will include particular symptoms that patients should monitor for, as well as the recommended treatment for those symptoms in particular zones of symptoms. In a green zone, patients will have stable asthma symptoms and do not require much need for their rescue inhaler or have limitations of activity. Their symptoms are stable and patients can continue their daily controller medications as prescribed by their doctor. In the yellow zone, which is a caution zone, patients may be experiencing mild chest tightness or mild wheezing, and patients should add certain medications to their treatment as recommended by their doctor. In the red zone, which is more of a danger zone, patients may be experiencing symptoms of acute worsening or may feel that their medications are not helping their symptoms. In this zone, patients may need to seek immediate medical attention either through their doctor or in an emergency room to treat their uncontrolled symptoms. It is important for patients to stick to their asthma action plan because it is an individual treatment plan developed by their doctor based on the doctor's assessment of the patient's symptoms and their history. If a patient is concerned about their asthma action plan or how to follow it, they should contact their doctor, who can review specific instructions and provide reassurance that the patient may need to improve their asthma control and prevent any worsening of asthma symptoms.